Hello everyone, in this video we will discuss about collection of blood. By this video we will begin the series of practical hematology. So we're going to the first and the foremost topic, that is the collection of blood. Now collection of blood can be done from the skin puncher, it can be done from the venous blood collection. Let's begin with the skin puncher. Now, this method is most commonly used in infants and in small children, as the veins they are not easily palpable in them. Or in adults, if the blood required is very small, then we will use this method. Now, the blood which is obtained by skin puncture is the capillary blood, and its composition is slightly different from the venous blood, which we will discuss on later. Now, how we obtain it is, in adults, we obtain it from the either the side of the ring finger or the middle finger. We will obtain from that, or rarely, in some cases, earlobe can also be used. However, in infants, the preferred location is heel. You can see it is heel. We will obtain it from the plantar surface, either the median or the lateral surface. Both are preferable. Or sometimes we can also take it from the great toe. Now, going to in which situations, in which procedures it is helpful. It is helpful in we can do cell counts from here, we can do hemoglobin, we can also estimate the blood group from this. Then we can also use to determine the PCV, the hematocrit, by the micro method, because the blood obtained here, the blood needed in this method is very less, and it can be the capillary blood can be used over here. Then preparation of the blood films, as you all guys do in the practical labs, the preparation of the blood films is done by this. Now, going to the method. What is the method? Method is, firstly, the puncture site is cleaned by ethanol, and after drying uh, the ethanol, the puncture is made by a lancet. The lancet should be sterile, should be dry, and disposable lancet is used. And the puncture should be deep, so as it should allow the free flow of the blood. We should not squeeze the finger. The free flow of the blood should be there. Now the first drop of the blood, it is wiped off, and then the next drops they are collected. And lastly, we will put some sterile cotton to the puncture site, so that the bleeding stops. Now going to the some pointers which are important in case of capillary blood, that is the skin puncture. Firstly, excessive squeezing should not be done, because it will dilute the blood with the tissue fluid, and then the reading will be different. Secondly, we should also remember that as compared to the venous blood, the hemoglobin, the PCV, the red cell count is slightly higher in capillary blood, and that should be kept in mind. Also, the platelets, they are lower in case of skin puncture, because they adhere to the puncture site, and the platelet count is lower, somewhat lower. Also, the blood should not be collected from any cold cyanosed skin. If the patient is cold, uh, if there is cyanosis, it should not be collected from there, because there is false elevation of hemoglobin or red cell counts. Okay, now going to the venous blood collection, that is the main one. We will firstly discuss in detail the method. It is very important to know each and every step, because each and every step makes a difference. Now firstly, the preferred veins. The preferred veins are veins from the antecubital fossa, because they are easily accessible, and they are easily visible, so that the puncture can be made. Now the rubber tourniquet is applied on the upper arm, and this tourniquet, it should not be so tight, and it should not remain in this place for more than 2 minutes. And then the patient, after applying the tourniquet, the patient is asked to make a fist, so that the veins become prominent and they are palpable. Now the venipuncture site is cleansed with the ethanol, and then you will stretch the skin, so that the this, vein is secured. Now The sterile disposable needles, here lancet is not used, here the needles or syringe should be used for venipuncture, and the needle size is also specific. It should be 19 to 21 gauge in adults, and it is 23 gauge in the children's. Now the puncture is made so that such that the bevel of the needle is up and along the direction of the vein, and the blood is withdrawn slowly. Now it should be remembered that the blood is withdrawn slowly, because if you will pull the plunger of the syringe very quickly, this will cause sudden rush of the blood into the uh, syringe, and it will cause the hemolysis and also the collapse of the vein. Now the tourniquet should be released as soon as the blood is seen in the syringe. Now after that, next step is, after the required amount of blood you withdraw it. Now then a patient should open his fist, and then the needle is withdrawn from the vein, and the sterile cotton gauze is put over there, and then you will secure this with the help of a bandage. Now uh, this was about the withdrawing of the blood. Now what happens is, the needle when it is detached from the syringe, now the required amount of blood, this should be transferred into a tube. Now this tube, you should remember how to put it in a tube. We should not put the blood through the needle into the tube, because this will cause hemolysis. The needle should be removed, and then the blood should be put into the tube, and it should be put into the tube containing the appropriate anticoagulant. We will not discuss anticoagulant in this video, we will discuss in a separate video. Now the blood is mixed with the anticoagulant. We will do gentle mixing by inverting the container many times. Now again, it should not be shaken vigorously, because it will cause again hemolysis. We have to prevent hemolysis, and in each every step hemolysis can take place. And after use, now for your own protection, the disposable needles, they should be put in a puncture proof container. We should not try to recap it, it will cause a needle stick injury. It should be put in a puncture proof container for proper disposal, and then these tubes, they should be labeled. Now, and the labeling, the time of collection should be mentioned. The sample should be sent to the laboratory with a properly filled form, so that the required test can be done. Also precautions. Now let's discuss about some precautions which you should take while withdrawing the blood. Firstly, the blood should never be collected from an intravenous line, or the arm which is used from intravenous line, because this will dilute the blood sample. Secondly, the tourniquet should not be too tight, or it should not be applied for more than 2 minutes, as this will cause hemoconcentration. The puncture site should be allowed to dry completely from the alcohol, because it will again cause a variation in the results. The tourniquet should be released when we see the blood in the syringe, because otherwise there will be hematoma formation in the patient. And also we have already discussed that we have to avoid hemolysis, so that the blood is so for that we should withdraw the blood gradually. And lastly, for your own protection, all the blood samples, they should be they are considered infectious, and proper precautions should be taken. Lastly, now this blood should be tested. The anticoagulated blood should be tested within 1 to 2 hours of collection, and if this is not possible by any reason, this sample should be stored in a refrigerator for around 4 to 6 degrees Celsius for maximum of 24 hours. Some changes will be there, but that can be explained. Now after the sample is taken out from the refrigerator, this should be allowed to return to the room temperature. It should be mixed properly, not vigorously. A gentle mixing should be done, and then it should be tested. Now this was all about the collection of the blood. In the next video we will discuss in detail about the anticoagulants. Do like, share and subscribe if you like these type of videos. Ask any queries regarding this topic in the comment box. Thanks for watching this video.